Welcome, welcome, welcome. Thanks for coming out. We got a lot of new faces out here today. So thanks everyone. Thanks for all the people who have come back, who we haven't scared away yet. And for all the new faces who have joined us today. Just a quick show of hands. Who's here for medical education or to learn about the medical side of things? Sure. Okay. Who's here for more business, entrepreneurial opportunities and okay. Who's here for social justice, activism? Okay. And who's here to see me? You guys, all right. For those of you who are new, haven't been to High and Y meetup before, just a little about myself, if you'll let me indulge. I was a volunteer, came to High and Y meetup, loved what I saw, loved the passion and enthusiasm, and one thing led to another. I have the distinct privilege of putting these events together. So thank you so much for allowing me to do that and for bringing a room full of people together to talk about one of my favorite topics, cannabis. So thanks, guys. Quick background about High and Y. We're here together tonight, all of us, to change the way New York uses cannabis. So that's why we're here. We're here to learn, to connect, and to ultimately take action and make change. So thank you all for participating. Just a quick background about me. I'm a life coach and entrepreneur. I come from the tech world. I worked at a small company called Google. If you're probably familiar with it, I'm guessing. No? All right, we'll talk later. Some other things that we're excited about. We have a website now at IMI. Join the website. Share it with friends. You guys have friends who like cannabis, I'm guessing. So please invite them to the meetup, to the website. We're launching a new project, which you can find on the website, actually, if you go under videos. I've been interviewing leaders in global cannabis, and I'm posting those videos on the website. If you sign up for the mailing list, you'll get the updates. We got one with Ed Rosenthal coming soon. Right. Jasmine Hupp coming soon. We got a couple of really great ones coming out, so please be on the lookout for that. We live in this age of headlines where people don't really do the research and get the real learning. So I think this medical panel is perfect for getting you that in-depth education, because it's easy to read the headlines and think New York's going the right way and that we have medical passed and it's going to be great. But for those of you who have looked into the law and are a little familiar with the program and maybe know patients who need medicine or are a patient who needs medicine, you're going to realize that the medical program is incredibly restrictive. And the only way we can do anything about that is if we speak up, if the business community speaks up, the medical community, like these guys, speak up, and all of you have a responsibility to get educated and have the conversation. So I'm hoping that you can do me a big personal favor and take one thing you learned from this panel today and have a conversation with anyone about it tomorrow and just start having those conversations, because the more people like us start having those conversations, the better equipped we are as a community to actually have progress. So if you can do that, awesome. And if you really want to go above and beyond and be a leader in the cannabis movement, tell a friend about meetup.com/highandY. Have them join the meetup, have them come to an event. Even if they don't come to an event ever, one, they're missing out tremendously, but two, the numbers on our side makes it a lot easier to get into venues, to bring speakers, to do a lot of new projects where when we can say we have the support of 1,000 New Yorkers as opposed to 500. So if you could all tell a friend, we'll double overnight, and that would be pretty cool. Lex is a scientist and a writer. He's been spending the last 2 years traveling all over the world talking to experts on the medical side of cannabis. He's writing a book that's coming out really in no time at all.
Don't hold your breath. It's a graphic novel about pot based on Moby Dick. And I just finished laying out the bones, so it'll be a while. But yeah, the research side is done, which is nice.
Lex knows like 100,000 times more than I do about the medical side of things. I'm honored to have him here. He will take it away and introduce our panel.
Just before I let our panel introduce themselves, I thought it'd be a good idea to start off with a quick 2-minute drill about what the actual law is for New York State medical marijuana. Because it's, like every state, the laws are exceedingly complicated, and if you go like Colorado, it's a pretty good system overall, and if you go like Washington State, you can really make a money-hungry, pretty not very good system where kids are still getting busted on the street a lot. So the nuts and bolts of the laws on this stuff matter tremendously. And just because the headline says the fight is won, it doesn't have to be. Especially in who's getting busted for its side. The racist side of the drug war can absolutely roar on while white grandmothers are getting their medicine. It doesn't have to solve everything. So New York, when it became medical, was the 23rd state in the country to have medical marijuana, which is pretty great. One strange part of the law is that there's a 7-year sunset on it. So if it's not renewed in 7 years, it just disappears. So if you took the last 7 years to invest millions in this business and build it up, it could just poof and go away. And the feds can always raid, because they always do. The qualifications for patients are if you have cancer, HIV, ALS or Lou Gehrig's disease, Parkinson's, multiple sclerosis, spinal cord injuries, epilepsy, irritable bowel syndrome, or Huntington's disease, you qualify. Which is actually a really good list. Those are the things that weed works very, very well on, and it's good that those are covered. And it will help thousands or tens of thousands of New Yorkers, but still very, very limited. And there are the health administration can add more diseases if they want to. And a strange twist of the law, they have to decide in the next 18 months on if they're going to allow it for Alzheimer's, muscular dystrophy, dystonia, PTSD, or arthritis. So the bureaucrats will make a decision on that sometime. They have to. On the patient side, it's going to cost you $50 to get a medical card with a 1-year expiration date. So you're paying a $50 tax every year just for medicine. Though if you're terminally ill, your card will go longer. You are allowed to possess up to a 30-day supply, whatever that means to you in the state and whatever your doctor says. And there's no coverage for out-of-state medical patients. You can still get arrested if you're a patient from somewhere else. And then for doctors, it's fairly annoying because they have to register with the state before they can give away cannabis, and then they have to go through a course of something 2 to 4 hours on how to administer cannabis, which if you're a busy doctor would be really annoying to have to go in for continuing education credits on something that you probably know pretty well. If you are deemed smart enough to give out oxycontin at any dose that you want, you should be allowed to give out weed. So that's going to mean a lot less doctors will do it because they don't want to go through the hassle of it. And doctors can often be a scaredy cat bunch. I mean, you're always scared you're going to lose your medical license for this stuff. And in a really amazing twist of fate, they actually created a new felony for doctors in New York state law. So we now have medical marijuana, but we also have a new felony charge for doctors who are illegal or dispensing it outside what they think is good. So really that's to keep away the California Wild Wild West pot doctor type who's just pumping out just prescriptions for anything. So now the doctors will be more scared because there's a new law aimed specifically at the cannabis doctors. Probably the lousiest part of the law overall is that the health department will select who the manufacturers are and that are allowed to produce medicine. And the worst part is there is no smoking of medicine in New York State. It will only be tinctures, edibles, oils, all the other things. But you cannot get medical flower, whether that works for you or not. You can do vape pens, which is probably a better, if you're truly a medical use, a vape pen is usually going to be better than smoking pot anyway. There aren't many advantages smoking versus vaping, but if you're an old hippie who likes smoking pot, you can't. You have to vape. And only 5 manufacturers will be allowed in the entire state of New York. And they'll be selected by the health department for having good moral character, which means it's good, isn't it? Because that means Albany bureaucrats who are known for their good moral character will be selecting who can be our pot growers. And the pot growers can be profit or nonprofit. So a nonprofit organization like Valley Corrals, WHAM, which is one of the best models in the world for how to give pot to medical patients and be honorable about it, has no extra leg in the game versus a come in bureaucratic gun the money types. And each manufacturer can only have up to 4 dispensaries total. So there's only going to be 5 licenses in the entire state, and they can only have 4. So that means there's only 20 dispensaries in the entire state of New York. And they won't be surely once you get your license, you're not going to put up 4 stores right away because nobody has the money for that. So it's going to be even slower rollout because of that. And actually, the pot manufacturers have to be unionized, but they cannot strike, which I thought was a New York twist. And for any of you Californians in the room, the really sad part is the grows must be indoor. So it has to be done under lights. It has to be probably with chemicals because that's the way that makes lights easiest. And no sun-kissed weed. You know, the grape country up north could grow good weed, but you can't. And the last part is that the price is set by the Health Commission, which is a hell of a way to run a business. And the insurance is not liable to cover medical marijuana. And the surprising part in defense of New York is that the state tax is only 7%, which is actually incredibly low considering that Colorado's around 25% and Washington is 50%, can be even higher depending on how they decide to tax it. But that's also for retail. I mean, there's in the Sufi tradition, you're not allowed to tax medicine and necessities, and so they're putting a tax on medicine, which is a terrible thing to do. But that is the quick rundown of what the law looks like for New York State. It's often called the worst medical marijuana law in the country. I don't think it's quite that bad, but it's pretty poor, and it would be a very dicey water for any investor to want to jump into, or any advocate. You really, if you jump into New York's medical marijuana, you have to be a true believer because you could absolutely not only lose all your money, you could lose your freedom. Most likely, it would just be your money in this state, but it could all just poof and go away. So that is the rundown of New York State Medical. So now I'll introduce my friend Dr. Andrew Tatarsky, who is an expert in harm reduction.
So this is a wonderful gathering, and I appreciate Michael and the gang and Lex for inviting me to be part of it. I'm a psychologist, and I've been working with people, with drug users for 35 years as a professional. I came into the field when the only game in town was abstinence-only disease thinking, and really over the course of the first part of my career, I came to recognize that that model doesn't help the majority of folks that are drug users and hurts a lot of people and turns people off from getting any kind of help. And I came to, through that process, evolve to see the wisdom and the beauty of a harm reduction framework. And even in thinking about harm reduction or benefit enhancement, harm reduction, more recently I established a center called the Center for Optimal Living, which is really organized around supporting people in developing, I mean, in one sense, we could say that we want to help people develop their healthiest or ideal relationships to substances or other risky behaviors. So the thing that I thought about in preparing to come here was that I want to make a case for the need for this industry, for this movement, to have harm reduction protocols. What I have in mind is that, you know, marijuana, as we all know, is a wonderful, interesting, complicated plant that has tremendous potential to heal the planet, I think, in many ways. But there are also risks associated with it, just like there are with any medicine. And in fact, I don't think that doctors, by and large, do a very good job at helping their patients use the prescribed medications optimally. So I think that actually the medical cannabis industry could take the lead in developing harm reduction protocols. And I think those protocols can support users of the medicine in maximizing the benefit of the medicine and minimizing risk, and can also help providers kind of develop models for harm reduction counseling or coaching, or what one of my colleagues, Scott Kellogg, calls wise use. And I think that that's something that we should be thinking about with all substance use. I also think it will be great for the industry, because the industry can show that it's taking a responsible position around risk and really take the lead. And I think it probably needs to weigh in on what the state regulations are, whatever they're telling doctors to do, because doctors, by and large, are not well educated about drug use. They're probably not going to be well educated by the state about how to administer medical marijuana. So I think that we need to really take that on. You know, so at my center, we work with individuals, we train organizations, we consult around developing harm reduction protocols. And in fact, right now, my wife, Wendy Miller, who's here, and I, and some of our colleagues at the center are really starting to develop, work on developed manuals and things that people can actually work from. Let me just tell you, like, some of the ideas that I have in mind that might go into that kind of protocol. I think we need to set the stage for working, you know, developing ideal relationships with cannabis by working on our attitude as a starting point, because I think we've all been inculcated with negative attitudes about drugs, drug users, and that those negative attitudes, I think, can really get in the way of people just looking at their substance use in a more constructive kind of way. So cultivating an attitude of self-compassion, of acceptance, of curiosity that can clear away these kind of internalized stigmatizing ideas can enable us to just look at, you know, our relationship in a more clear way. And certainly education about risks is a key, and also about benefits. So I think education should be a part of any protocol. Then developing skills for being able to sit with oneself and look at one's experience around using. And now I have in mind mindfulness, you know, awareness training, being able to sit still and cultivate a kind of accepting, compassionate attitude, so that you can then set about evaluating your use. You know, in what ways, you know, evaluating the pattern of use in terms of its benefits and its risks, so that, you know, the relationship gets evolved over time to a place where it's really ideal for each individual. And that varies widely. You know, for some people, cannabis is not a good medicine. For other people, it's an ideal medicine. But how do you find that, strike that ideal balance in terms of things like amount, strain, strength, frequency, and so on and so forth, different circumstances? What are all of the conditions that contribute to an ideal relationship? And, you know, I do think that we come to substance use with a lot of complicated mixed motives, some of which are very positive and life-enhancing, and some of which may be very self-defeating. And so creating a space to really evaluate our motives, you know, what brings us to the moment when we have an impulse to use, I think can be a key. And those skills enable us to sit still and have that dialogue with ourselves. And then we can work on getting clear about our goals and kind of a strategy for having, you know, our ideal outcome from the substance. So these are just some ideas that I've been working with, and I would actually love to us to have a dialogue as a community about what that protocol might look like. So I wanted to say one other thing. I have some papers that I wrote on my integrative harm reduction psychotherapy approach. It's taking these ideas and applying them to psychotherapy and counseling. So if anybody's interested from that standpoint, you can come up and get a copy of the paper. Oh, and finally, partly at the urging of Dana Beal, I and a group of other addiction professionals have recently started a process of developing an organization of addiction professionals against the drug war. We have felt for a long time that addiction professionals, I'm talking about treatment people, research, academics, prevention people, are the people that know best about the impact of the drug war on drug users, and we should be organized to have a loud voice, to take a loud position and speak to the government about their position. So that's a process that's just gotten underway. We have gathered together a really strong group of initiators, and we've gotten some support from major people from around the country. So if anybody here is a treatment person or an addiction professional or knows one who wants to get involved, they should get in touch with me. So thanks a lot. I'm happy to be here.